Thank you for choosing Morton Plant Rehab Center for your loved one's rehabilitation needs. As we continue to navigate through these difficult times, we have just a few visiting tips we want to review with you. At Morton Plant Rehabilitation Center, the safety of our patients and staff is of the utmost importance to us. Please watch a short video highlighting the visitor infection prevention guidelines and education. Here are our general visitation guidelines. Our center is open 24 hours, 7 days a week. Although we do not have specific visiting hours, we ask that if you are visiting after 9 p.m., that you coordinate this with the center. If you have 2 or less visitors, no appointment is necessary. If you have 3 or more visitors, we ask that you make an appointment so we can accommodate the visit in a larger area, allowing room for social distancing. Upon each center visit, you'll be required to go through a short screening process at the front desk. The screening is a series of questions that we're required to ask everyone entering our building. If you have any of the symptoms listed upon screening, unfortunately, you will not be permitted to visit. If you pass the screening, we ask that you go directly to your loved one's room or designated common area. Please don't wander through the hallways. No matter the quantity of visitors, we strongly encourage social distancing, even with your loved one. If we have a COVID-19 outbreak, which is considered one team member or one patient who tests positive, a member of our team will notify the patient's primary representative. We ask that if you have signs or symptoms or are just not feeling well, that you not come to the center until you're feeling better. There are mask guidelines to follow. To ensure everyone's protection, we ask that all visitors follow our mask guidelines. The colored part of the mask goes on the outside. Be sure to fully cover your mouth and nose while wearing your mask. Since the front of the mask is always exposed, it's considered dirty. So please use the straps to remove and/or adjust your mask instead of touching the front. We strongly encourage you to always wear your mask, even while outside. Hand hygiene is important. We ask that you use hand sanitizer. Hand sanitizer can be found throughout the building, in every patient room. Please use it before entering a patient room and before you leave. Rub hand sanitizer in for 20 to 30 seconds and make sure to get enough sanitizer to fully coat both hands. As for soap and water hand hygiene, we request the following. Hand washing is one of the most important steps everyone can take to prevent the spread of germs. We ask that everyone wash their hands with soap and water after using the restroom. The proper hand washing technique is to turn on the faucet with a clean paper towel, wet your hands and apply soap, then lather your hands by rubbing them together with the soap. Make sure to lather and scrub the backs of your hands, between your fingers, and under your nails. You should scrub your hands for at least 20 seconds. Rinse your hands afterwards. Lastly, dry your hands using a clean paper towel and use that same towel to turn off the faucet. If you have any questions about any of these guidelines, please make sure you speak to the front desk. Thank you for your time.